Rhodes University Psychology Department. I'd like to talk to you about substance use and substance use disorder. Substance use will put you at a greater risk of contracting CV-19 due to the exposure of pulmonary and respiratory diseases. Opioid users, for example, induce respiratory depression, and respiratory depression leads to lower oxygen content in the lungs, which makes a person more vulnerable for any infection affecting the lungs. If you are addicted to drugs and you are out there in the street trying to get your next fix, or if you are addicted to alcohol and you're trying to go and get money or sell bottles to get your next drink, you are putting yourself and others at risk. When you are intoxicated, you forget to wear a mask or even follow CV-19 protocol. Without a support system, it's difficult for substance users, and we need to be careful not to criminalize individuals who struggle with addiction, but help them to seek help. We are social creatures, and we need to depend on social support for a sense of well-being. This is also the case for people who are struggling with substance use disorder. So social support in the form from, organizations such as SANCA, which I've worked with nationally, and even the Salvation Army, which I've worked with for many years, they sometimes, in dire cases, they would provide free care for people, or they would provide alternative care. And so that is a source of relief for the family that is struggling to cope with an addict during this period. And there are places that are also offering online cyber psychology relief for people and families who are living with people who are addicts. And when I say cyber psychology or online services, I'm talking specifically about the 12-step programs. So if you do a Google search, if you have access to the internet and you use a Google search for 12-step programs, it could be AA, NA, or any sort of 12-step program that you are in need of, you could try and hop on the regular Zoom meetings that they have, or even WhatsApp support groups via a support system. There are other alternatives for people who don't have access to online support or online psychological services. So you can go to your local primary care clinic and you can get a referral to an organization that could assist you with addiction, or assist at least the family with psychoeducation on how to cope with living with an addict. It's important to understand that social structures are available, and even before CV-19, there were cases where people were not able to receive help for addiction. But now we have become so creative that there are many structures available. All you have to do is go to the primary care clinics, go online, do a Google search, and get help. We need to learn patience, tolerance, and understanding of addiction through psychoeducation, which is available for referral at most government primary healthcare facilities. It's important not to forget that during this time of isolation and uncertainty, we must not forget that people are still suffering. Right now, we're trying to feel better, we're trying to do better, and we're trying to go back to life before CV-19, right? But for people who are already trying to numb the pain that they were struggling with before CV-19, it's really easy for them to relapse or to actually start becoming addicted to substances to numb the pain. My advice would be to go online and Google 12-step programs. But for people who don't have internet access, again, my advice is for loved ones to seek help via governmental structures like primary healthcare clinics. I want to end off my message by saying, please be safe and please be tolerant and patient with people who are suffering with addiction. Goodbye.